Welcome guests. We are just continuing to admit people from the waiting room and we'll be starting soon.
Good morning, everybody. I'm Rosemary Heilemann, and I'm the co-chair of Issues and Advocacy for the League of Women Voters of Illinois. And we are very happy to tell you that we have some accessibility features for our issues briefing today. First of all, we'd like to thank our American Sign Language interpreters, Vera Marie Baldoza and Sheila Kettering, who you will see on the presentation today. So we're very pleased to have them with us. And also we have enabled subtitles. So if you would like to activate the subtitles for the presentation, you look down to your bar at the bottom and you'll either see the little box with the two little C's and the words live transcript, or you might need to go to the box that says more. And then if you click on either that little arrow by the CC or on more, you'll see the options here to show subtitle or other options. If you click on show subtitle, you will start seeing subtitles. If you are tired of seeing the subtitles, you didn't intend to hit it, just go back there and click on hide subtitles. And then if you'd like to make them larger or smaller, you can go to subtitle settings and click on that. And then you will get some kind of a bar with a movable slide that will change the size of your subtitles. So I hope that you enjoy the program today, and I'd like to introduce the president of the League of Women Voters of Illinois, Allison Hout.
Thank you, Rosemary. Good morning. Good morning on this beautiful sunshiny day. My name is Allison Hout, and it is my honor to serve as the president of the League of Women Voters of Illinois. Welcome to session 2 of Issues Briefing 2021, the League's annual forum for examining the critical issues of our times. This day is brought to you by the dedicated efforts of the League of Women Voters of Illinois Issues and Advocacy Team, which is co-chaired by board members Jean Pierce and Rosemary Heilemann, and powered by 25 issue specialists, along with local leaguers from around the state. We thank all of you for your efforts. Again today, you are sitting right in the front row as experts bring to us unique perspectives and in-depth analysis, highlighting needs and identifying pathways to change. It is needs that are front and center today, as our sessions focus on inequities and representation. We will absorb, consider, and make decisions about how we as individuals and communities will be influencers, change makers. Having a voice and using that voice is a powerful tool at the core of influencing change. As elections occur at every opportunity, we use our vote as our voice. How are we to have a voice in between? Well, our representatives in government are our daily voice. These people need to hear from us. They want to hear from us. We need not be silent if we think they already agree with us. We need not wait until a certain piece of legislation is on the table. We do need to share our views all the time, give direction and encouragement to pursue the values we care about, the values we hold dear. So we contact our representatives to share our big picture views. Things like, I want the senator to know that I am committed to dismantling systemic racism in my community, and I want the senator to be working towards these same goals. Affordable housing is a crucial element in. I believe that immigrants, we must follow through with our thoughts and ideas and communicate with our leaders. And it could not be easier, especially if you are prepared, which is why we are gathered here today. In addition, I ask you to take this simple action. Make a simple plan so that when you have a thought or a concern or a view, your voice is heard. Find those phone numbers and email addresses for your representatives in your local, state, and federal government. Write them on a card, put it next to your landline or next to your computer. Pick up your phone and add them to your address book. Like this. Let's see. Unlock that screen. Can you see? There we go. Senator Dick Durbin, Tammy Duckworth, all the way through my list to my village manager. They're all in here and I can get a hold of them. So take all those steps, give your views a voice, be a change maker. Thanks. And now Jean Pierce will move us right to that preparation for being change makers in our first session. Take it away, Jean.
Good morning, everyone. Welcome to the second session of the 2021 issues briefing. This morning, we invite you to join us for 3 programs. The first addresses systemic racism and equity. The second focuses on issues concerning immigrants, and the third looks at redistricting. We will be recording each session, and the recordings will be available with supplemental resources on the website. While our speakers are talking, we invite you to click on chat at the bottom of your screen and type in your own questions. Our first program is titled Recognizing and Doing Something About Systemic Racism and Inequality. In the interest of making sure that everyone gets a chance to be heard, speakers will have a strict 10-minute time limit. Ann Corder and Bill Kale will be monitoring the chat, and questions will be asked after all our speakers have talked. Now, I welcome issues specialist Elizabeth Joy Guscott-Mueller, who will introduce our speakers.
Thank you, Jean. Good morning, everyone. My name is Elizabeth Joy Guscott-Mueller, and I am president of the League of Women Voters Lake Michigan region and a member of the League of Women Voters Illinois Issues and Advocacy Committee. We are delighted to welcome this distinguished panel to enlighten us on the topic of recognizing and doing something about systemic racism and inequality. Our panelists, Dr. David Ansel of Rush, Delmar Gillis, Chief Operating Officer of Elevate Energy, and Sharon Mitchell, Director of the Illinois Justice Project, as well as Nushin Hussain, a senior reporter at Chicago Tribune, will each discuss the effects of systemic racism and inequality in their area of expertise and how these inequities manifest themselves and impact our communities and what we can do about it. Each panelist will present for 10 minutes, followed by questions posed by the moderator. We invite you to submit your questions into the chat, which will be monitored by Bill Kale and Ann Corder. Panel, we thank you so much for joining us today, and we are so looking forward to your remarks. Our first speaker today is Dr. David Ansel, MD, MPH. He is Vice President of Community Health Equity at Rush University Hospital and on the faculty at Rush University College of Medicine in the Department of Internal Medicine. He is the author of County, Life, Death, and Politics at Chicago's Public Hospital, a memoir of his 30 years on the staff at Cook County Hospital. The University of Chicago Press published his second book, The Death Gap, How Inequality Kills, in 2017. Dr. Ansel leads Rush's strategy to be a catalyst for community health and economic vitality on Chicago's West Side. He joined Rush in 2005 as the medical director's first chief medical officer, a position he held until 2014, as well as the associate dean and senior vice president for clinical affairs, and the Michael E. Kelly, MD, presidential professor at Rush Medical College. Please join me in welcoming Dr. David Ansel.
Thank you very much for having me this beautiful morning. Spring is coming and we can feel it all around us. And I want to thank the League of Women Voters for taking this on. You are a force and a reminder of what we can all do together. I want to frame this 10 minutes, which for me is just a warm-up, in a context that I believe is critically important to make change in this world. And it goes like this: narrative plus data plus action equals change. So I'm a general internist. I'm a primary care doctor. I practiced for over 40 years now on the west side of Chicago. And I came to Chicago because in medical school, I thought that something wasn't right. And I couldn't quite put my finger on it, but a group of us got together and we realized that for us, health was a human right. And we have not decided in this country that health is a human right. That led me to come to Cook County Hospital to practice. And I spent 30 years between Cook County Hospital and Mount Sinai Hospital, and my whole career practicing on the west side of Chicago. And I got recruited to Rush to be the inaugural chief medical officer, really focused on quality and safety. But I couldn't help but think about my experience down Ogden Avenue. And I want to remind people that the lands that we are on today are originally native lands, and their memories have largely been erased. But our Ogden Avenue, that many of you know, is the old Potawatomi Trail, the transit point between the Great Lakes and the Mississippi River. And I practiced my whole career along the old Potawatomi Trail, Ogden Avenue, something that I call one street, two worlds, because it was along that one street, there were two worlds of health, two worlds of healthcare, and the conditions that determined who lived and who died. And it really wasn't until I came to Rush that it really struck me. I describe it as a little bit like you leave a very loud concert and your ears are ringing. I kept saying, what just happened? What was going on these last 30 years? Because my patients and I did a litmus test on the health and healthcare system in Chicago, because they came with me from Cook County to Mount Sinai to Rush. And the insights that we had, same patients, same doctor, different systems, different opportunities, the different chance to live or die. And I just give this little example for clinically. I got involved with getting transplantations for the undocumented, public policy issue, critically important. But when I got involved with it, I realized that in my 30 years at Cook County and Mount Sinai Hospital, where I was a leader in both of those institutions, not one of my patients, in fact, exactly 0 of my patients ever got a life-saving transplantation because the transplant centers were out of reach, either due to lack of insurance or other reasons of lack of access. And yet the organs that went into the bodies of largely white people, but not just so, at the transplant centers in Chicago came from the Black and brown bodies in the intensive care units at Mount Sinai in county. I say this because the issues around health as a human right, particularly as we've seen during COVID, are still critically at the forefront of our work. And it made me begin to think that maybe what I learned in medical school as a doctor wasn't so much incorrect, but insufficient. And Rush is a very high quality academic medical center. When I got to Rush as the inaugural chief medical officer, I asked our CEO, Dr. Goodman, what was important. And at that point in time, our mission was to be among the best in quality in the United States. And Rush is ranked 1 in quality in the United States. It's the US News and World Report honor roll hospital. But in 2016, we changed our mission from being the best in healthcare, among the best in healthcare, to improving the health of the individuals and the diverse communities we serve. And for the first time, we needed to think about what it meant to improve the health of individuals and communities. We had never had that community language in our mission. And I took over our community health needs assessment. And this is something required under the Affordable Care Act to really look at the communities. And we looked at 10 West Side communities, an area of about 500,000 to 600,000 people, bigger than most cities in the United States, 40% Black, 40% Latinx, and 20% white, very diverse communities. And I presented this to our board of directors, that if you live in the loop, you can live to be 85 or in some neighborhoods, 90 years old. And the loop is a neighborhood of concentrated white affluence. But if you go down the blue line, past Rush, 7 stops from the loop, 3 stops past Rush to Garfield Park, that life expectancy plummets to under 69 years old, and in some neighborhoods, under 65 years old. And that life expectancy gap is not unusual, is actually, we see it across the country. And when was the last time that life expectancy in the United States was under 69? You'd have to go all the way back to the 1950s. And as a doctor, I began to consider, what did this mean? And I thought about my role as a doctor prescribing medications. And if everybody took a drug called a statin that's used to lower cholesterol to prevent heart attacks, we could add 20 minutes onto the life expectancy of Chicagoans. But what if we addressed the conditions under which people lived, worked, and played in these neighborhoods? How could we really impact life expectancy? So as a physician and as physician leader, I gave up being chief medical officer at Rush, a terrific job, and to move into this new role as a chief equity officer. And what we began to focus on were the social and structural determinants of health. And we began to name them in our community health needs assessment for the first time in Rush's 180-year history. We named the root causes: structural racism and economic deprivation, neighborhood conditions that led to poor health. And we committed as an institution that we would begin to do something about it. I just want to pause here just for a second, that as a white man, as a leader in an organization, in many organizations over time, it took me till about the age of 60 before I began to name racism as a root cause of poor health. In fact, as a chief medical officer, when something goes wrong in a hospital, it's critically important you do a root cause analysis. And you have to ask why. Why did something happen? The reason why you do that is you want to prevent harm from occurring again. And when we looked at the root cause of the low life expectancy in Garfield Park and other neighborhoods, it was critically important that we named racism. And that as a white leader, I began to name racism myself, because we're all living within the system which has had terrible negative consequences on life and health itself. So Rush decided to become an anchor institution, to hire locally, to create career pathways to wealth, to purchase locally, support local businesses, to invest locally, and to volunteer locally. And we created a collaborative called Westside United, which we'll talk about in the discussion. And Westside United is a racial health collaborative aimed at improving the social and structural determinants of health on the West Side. And I'm going to stop there. And hopefully we'll pick up more during the discussion. Thank you for the time.
Thank you, Dr. Ansel, for those compelling remarks. Really enlightening, and we appreciate it. Our next speaker is Delmar Gillis. As Chief Operating Officer for Elevate Energy, Delmar Gillis is responsible for implementing operational, workforce development, and project management in support of Elevate Energy's growing portfolio of clean energy projects. Mr. Gillis currently leads Elevate's core operational functions and also supports business development, program design, project coordination, and contract management for Elevate's diverse energy efficiency and growing renewable energy programs. Mr. Gillis plays a critical role in supporting Elevate's work in increasing contractor diversity and launching energy assistance, community solar, and smart grid programs for Illinois utility customers. Mr. Gillis is also managing efforts to implement new business strategies and solutions. This includes supporting job-creating workforce development programs that focus on underserved environmental justice communities across the state. He is also supporting the ongoing development of IT project management and quality systems and tools in support of Elevate's clean energy programs. Please join me in welcoming Delmar Gillis.
Thank you. It is indeed an honor to be here this morning, and I'm really looking forward to today's discussion. What I wanted to just spend a few minutes on this morning was talking about the intersection of race and environmental policy. And a lot of what I'm talking about dovetails very nicely with what Dr. David Ansel was talking about, as he talked about the social determinants of health. A lot of the work that I do actually focuses on the social determinants of work and access to opportunities. And a lot of the stressors and determinants that he talked about are very similar to the ones I'm working with. When you look at a lot of the maps, especially of the Chicagoland area, one of the things that you see is that maps for increased like COVID infection, of negative health outcomes, overlay almost exactly with maps related to environmental impacts, lack of access to opportunities as it relates to jobs in the environmental community, et cetera. So there's a lot of similarities between a lot of these topics. But what I wanted to just touch on is I am currently in the process now of working on some clean energy legislation in the state of Illinois, and it's called the Clean Energy Jobs Act. And in 10 minutes, I won't be able to go over all of it, but I do want to touch on especially the equity provisions, because those are things that are very critical to all of us. As I mentioned, the Clean Energy Jobs Act, or CEJA, is legislation that we're currently working on that will hopefully reach the floor in the state of Illinois in the spring session. It's roughly a 890 plus page bill that focuses on how we are going to implement our clean energy economy in the state of Illinois. The sections that I have primarily focused on are really sections that talk about equity, access to jobs, and how to engage underserved communities. But the Clean Energy Jobs Act also focuses on, to a large degree, renewables, energy efficiency, electric vehicles, electrification of our transportation networks, as well as our utility rate structure. But one of the core tenets of this legislation is focused on equity. And what we tried to focus on was how can we weave equity into every single aspect of our clean energy economy. We don't have to go back too far to think back on cable television, cell phones, computers, to see how oftentimes new technology, new economic drivers often reach communities of color last and often don't have the impact that it does in majority communities. And so as we are thinking about what the next big economic driver is going to be, we really want to make sure that everyone is brought along. And there's a lot of good reasons for this. And I could dive into a lot of the social justice reasons. But one of the things I think that really resonates with people is a very simple comment, which is we're all breathing the same air, drinking the same water, and are all impacted by the same environmental toxins. We're all impacted by bad environmental policy. So if, for instance, one of the examples I like to talk about is there's a company called General Iron that has a facility in Lincoln Park. And there was a significant community uprising that they no longer wanted this facility in Lincoln Park. The plant was basically snowing toxins. People were getting sick and ill from the plant. And it was just deemed a community hazard. So guess what happened? A decision was made to close this particular facility. And then lo and behold, the company was applying to open a new facility, guess where? On the south side of Chicago. Well, guess what happens when those kinds of things happen? The same pollutants, toxins that are in the air and water are still impacting everybody. So if we have environmental racism, if we have situations where we are pushing the problem to other communities, ultimately it's going to impact everybody. Depending on which scientists you like to listen to, we have between 10 and 15 years to address our environmental needs for the planet before we reach a point of no return. And we can't do business as usual. We can't fix things in affluent communities and then leave underserved communities not taken care of, because ultimately that's going to lead to a situation where the holistic problem is not being addressed. And so what we tried to tackle in CEJA is what do we need to do from a community perspective, from a jobs perspective, from an environmental impact perspective to address environmental racism, to address inequity, to address the challenges in our communities. So just really quickly, I know I have roughly about 3 minutes left. I just want to touch on some of the things that we're doing. One, we're trying to build community capacity. So with that, what we're trying to do is not just have programs implemented in the community, but are we building the businesses in the community that can sustain a lot of the programs? So when we look at, say, providing community-based solar energy and environmental justice in underserved communities, the suppliers that are providing the services, the equipment, the tools should also be based in the community. And if the community does not have those resources, what can we do to train, develop, and build that community capacity? Another area that we're focused on is how we can provide low-cost solar. Specifically, solar can cost anywhere from $10,000 to $25,000, depending on a variety of factors for a home. And many underserved and environmental justice communities can't afford that outlay. But that outlay also leads to a 50% reduction in utility bills, as well as a significant reduction in CO2 gas. So what the state is doing, or what is recommended in this legislation, is that the state support and subsidize especially low-income community members, because the environmental impact once again benefits everybody. We're also looking at ways of providing community solar so that folks that maybe don't have the roof space, say in an urban environment, can be part of a collaborative that takes advantage of a solar array in a location that can support it. We also have a wealth of jobs programs. We have a wealth of training programs for contractors, and we have provided incentives to support the growing solar market. The big question, especially that my conservative friends will often ask around this, is, well, where is this money coming from? And the good news is that this legislation does not require any increases in taxes. It does not require any additional state revenue. If many of you were to look on your utility bill, there's actually a fee on there that everyone in the state pays into. There are also some built-in fines for heavy polluters that would help subsidize some cost. So I'm going to wrap up here, but what I have provided is I did provide a link that the moderator has shared with everyone to the Clean Energy Jobs Act at ilcleanjobs.org. We're always looking for feedback, community partners, etc. And I also just wanted to point out that the two legislative leads for this are Representative Ann Williams and Senator Christina Castro. So if you do have any additional questions, want to further engage, please feel free to reach out to me or one of them. Thank you very much, and I appreciate the opportunity.
Well, thank you, Delmar. We really appreciate your remarks. Fascinating information, and gives us a lot to think about and talk about during the discussion section of the program. And so up next is attorney Sharon Mitchell. Sharon Mitchell joined the Illinois Justice Project in July of 2016. Previously, Mr. Mitchell was a trial attorney with the Cook County Public Defender's Office from 2009 to 2016. Mitchell's work focuses on adult justice, specializing in pretrial issues, sentencing policy, and violence prevention. His responsibilities at the Public Defender's Office included handling complex felonies, ranging from serious Class X felonies to simple misdemeanors, including trying countless bench and jury trials in the criminal division. Currently, Mr. Mitchell serves on the board of St. Leonard's Ministries, an organization that provides comprehensive residential, case management, and employment services for those released from prison without resources. Sharon Mitchell earned a law degree from DePaul University College of Law, and we are delighted to welcome him today to the panel.
Good morning. Thank you all so much for having me. Like we said before, my name is Sharon Mitchell Jr., and I work for an organization called Illinois Justice Project. You know, at Illinois Justice Project, we work on supporting people and programs and policies that can reduce inappropriate incarceration, that can improve community safety outcomes, that can reduce recidivism, and that can make the criminal justice system a bit fair. So I'm here to talk a little bit about the criminal justice system, the criminal legal system, and that is a big topic. There is a lot to cover, but I will kind of focus my comments on some work ILJP has been doing, along with the Coalition in Money Bond, on working on pretrial policy. As you may know, the Illinois General Assembly passed a bill and the governor signed a bill that, among other things, ends the use of cash bond. And it's been something that ILJP and groups, including the groups we've involved in, including the Coalition in Money Bond and the Illinois Network for Pretrial Justice, have been working on for quite some time. So let me talk first about the Coalition. It is a group of incredible organizers, advocates, service providers, members of the faith community, activists that all have come together around the idea that wealth-based pretrial incarceration is wrong. So what do I mean by wealth-based pretrial incarceration? When a person is arrested, they go before a judge, and the judge has to make a decision about what happens to that person during the pendency of their case. The judge in the status quo can do one of three basic things. The judge can hold the person in jail until the case is resolved. The judge can release that person. The case is still pending. The person will still be held accountable if they're found guilty. Or the judge can do what's a combination of one and two, which is basically give the person a money bond, essentially a ransom, saying they have to pay a certain amount of money. If they don't pay the amount of money, they're stuck in jail. And if they do pay the money, the case still goes on, but they get the opportunity to fight their case from the outside. And what we've seen in our system is a large expansion of the use of money bond, despite the fact that the vast majority of people who are in the system are poor. And the vast majority of people who are paying these bonds aren't the people who are accused of the offenses themselves, but their families. So in the status quo, we know that the vast majority of people who are paying these bonds are Black women. They're Black mothers, they're Black grandmothers, they're Black sisters, they're Black partners who are carrying the burden of this system. There was a report done in Loyola University that found that in a 6-month span in Cook County, the community has spent $31 million on bond. The vast majority of that, again, came from communities that could hardly afford it. And what we know is that money bond actually doesn't increase the likelihood that someone comes to court. And we also know if a person is stuck in jail, they are far more likely to plead guilty, and they're far more likely to serve a longer sentence than folks who are similarly situated, who have the same charges and the same criminal background. So pretrial detention, because of the overuse of money bond, has gone up 433% between 1970 and 2015. Currently, Illinois incarcerates about $250,000 per year. Those are pre-COVID numbers. And 90% of those people in those jails are their pre-trial, right? So they're jails and prisons. Prisons are places where people go after they're found guilty of a criminal sentence that's a felony. Everybody else who's incarcerated are in jails. And we know that there are about 250,000 people in those jails, 90% of the people there pre-trial. And we know that our use of cash bond has had a real effect when it comes to race. There was a study in California that showed that Black defendants got about 35% higher bond than white defendants who were similarly situated. And brown defendants got about 19% higher bond than white defendants who were similarly situated. Again, we know the numbers, say it again, folks who are in jail are 3 to 4 times more likely to plead guilty or be found guilty, and 2 times more likely to serve a longer sentence. So the coalition set out to end wealth-based pretrial incarceration, and we did it through this bill. So one of the things that gets talked about is, well, what will happen after we end money bond? There are kind of 2 segments to that argument, one kind of critique from the left, one critique from the right. The critique from the left is, well, listen, if you end money bond, will you significantly increase the amount of people that will be incarcerated pre-trial? And the answer to that question is we've created a system that will ensure that won't happen. We have seen other states like New Jersey in money bond and both significantly reduce their pretrial detention population, but also avoided any significant increase in crime. And they were able to do it by creating a specific structure, rewriting the decision-making process around who goes to jail and who doesn't go to jail. And that's one of the key pieces of the bill. And we can kind of get into details if somebody has a question about it. But we've created a structure that would define how decisions are made in a way that we're not increasing pretrial detention and that we're reserving detention for specifically those who have been found to be a specific, real, and present threat to any person or persons, or are a risk to willful flight from prosecution. So we feel very strong about this strategy, and it's been a strategy that we've seen work in other jurisdictions, and it's also a strategy that was promoted in a commission set forth by the Supreme Court. There's a Supreme Court Commission on Pretrial Practices, which made about 54 to 57 recommendations around how the pretrial system should look. And the system that is found in the Pretrial Fairness Act, which is the bond section of the governor's bill, has the things that we talked about. So on the right, one of the things that you hear about is, well, if you in-cash bond, you're going to make communities much less safe, that you're going to release everyone, and that's a bad thing. And I think that one of the things that is unfortunate is that there have been some real misconceptions about what we're doing with this strategy. People think that this is just, we're going to release everyone. But what I would argue is that, and it's not argument, is that the current system allows people to bail out the set amount of money if they have the money. So people like Kyle Rittenhouse, people like Jason Van Dyke were accused of murder on camera. But because of the cash bond system, because they had access to money, they were able to bond out. So it's no wonder that there are many victims' rights groups, the major victims' rights groups in this state supported our effort to end cash bond because they believe that we should be making decisions about whether somebody's in or out of jail based upon risk and not based upon money. So organizations like the Network Advocating Against Domestic Violence and the Illinois Coalition Against Domestic Violence supported this bill because there is a better way to do things. We shouldn't be using money to decide who's in and out of jail. We should be using risk. And we can reduce the amount of people who end up in jail while also being better about making decisions about those select amount of people that society would benefit from taking a break and being in jail. So the bill number, I believe it's called, I'm so bad with numbers. It is, let me try to look it up right now. I'll find the bill number. I saw the question in the 3653, but it was signed by the governor and is now law of the state. One of the things to also remember is that the system is really built on using money. And so to move from a system where we eradicate cash bond, we'll need time to implement this system. That's the reason why ending cash bond doesn't officially happen to January 1st, 2023. In the meantime, we will be working with the courts to implement, to train, to set new court rules. And we feel very strongly that we'll be able to see some of the success that we're seeing in New Jersey. Remember, the federal system, the juvenile system rarely uses money. DC doesn't use money. New Jersey has moved away from it. And we're really excited that Illinois has done it. And it's done it through the work of organizers, community members who demanded that this practice needs to end. So would love to, ready for questions when we get them. Thank you so much for having me. And I wish you guys a blessed day.
Thank you very much, Sharon. We really appreciate your comments and educating us on these really troubling statistics. And we look forward to the discussion in the question and answer portion of the program. Our next speaker is Nusheen Hussain. Nusheen is a senior reporter at the Chicago Tribune and reports on civil liberties, migration, inequities using both data and words. Recently, she's covered COVID-19 racial disparities, prison conditions and deaths, and the unique targeting and surveillance of Muslim communities. Nusheen has worked at the Chicago Tribune since 2014 and is an alumna of the University of California, Berkeley Graduate School of Journalism and New York University. Nusheen Hussain, welcome to the panel. We're delighted to have you.
Thank you so much for having me. So excited to be here. I just want to quickly shout out the ASL interpreters. They are like switching in the middle. I am just so impressed. It's very cool. So I'm going to go ahead and share a screen for y'all. Sorry for the... So like it has been said already, I have been a journalist since I was about 12. Most recently, I've been working at the Chicago Tribune as a data reporter and a writer. I have a very specific interest, which is Muslims and civil liberties, but my data reporting typically leads me down a variety of paths, one of which consistently is systemic racism, and in Chicago in particular, segregation of different kinds. Mostly though, I am just a reporter from an underrepresented community who is trying to tell stories more accurately. This quote that I hope you can see on your screens is from Ta-Nehisi Coates's "We Were 8 Years in Power," and it's one that resonated with me quite a bit when I first read it. It's this idea that you can understand something on an instinctual level, even if it's not something you see in the news or in your media, and you need to kind of research it, write about it, write it down, just so that you know that you and your people are not crazy. So often, even data collected, as is done in journalism a lot, glosses over people who are on the margins and on their issues. Mimi Onuoha talks about missing data sets, which is now on your screen. And I remember realizing when I saw this collection for the first time that there are data sets that people don't want you to have or have released to the public. And often the stories about systemic racism start with this. They start with realizing that there's a data set out there that you should have that people don't want you to have or that people haven't cared about releasing yet. And you start with the data collection, you start with the document collection, because in order to enact change, people need to see proof. And that's often what my work revolves around. As has been talked about by the wonderful other panelists we have here, one of the things we've been doing a lot this year is focusing on COVID and the inequities that exist in Chicago and other cities between white communities and Black and Brown communities in COVID cases and deaths, in medical care, in previous health issues. All of these things are things that exacerbate this pandemic for certain people and not for others. This that you're seeing now is a Twitter bot built by Southside Weekly that tracks where people are dying of COVID and where people are getting vaccinated. They've been doing this, I think, since January. It kind of reflects the idea that's been mentioned already that every map of Chicago is a map of racial segregation. And Delmar talked a bit about how certain Chicago maps overlay each other, and you'll see this here. The Financial Times did a story where they talk about this map and its counterparts in places like New York and DC and Baltimore, and they talk about how it's not just hesitancy on the part of Black and Brown communities to get the vaccine, which I did see mentioned in the chat earlier, though that's definitely part of it. It is who has the time and ability to research where vaccines are being distributed, right? So who is not working and is able to make it to get a shot whenever, wherever. Who is not nervous about their legal status or situation in this country, who is not afraid to voluntarily go and put their name on a list for a governmental organization, which if you ask the Muslim community, we're pretty nervous about that. So there are a lot of reasons for the discrepancy on this map that have to do with who you are, where you live, and what flexibility you have in your life. And all of that is based on segregation and racism to an extent. So this is from a map from 1940 made by the Homeowners Loan Corporation, which would essentially indicate which parts of a city were desirable or not. The little notes that you see, this little note at least, are called racially restrictive covenants. And you might have heard about this. It's essentially real estate agents making maps describing non-white neighborhoods as infiltrated by Jews, Asians, or Black people, and drawing red lines around them to mark them as undesirable. And this is called redlining, and I'm sure you've heard about it. And I'm just going to read out loud what it says about Maywood. The area is of mixed and rather poor appearance and unlikely to improve very much due to the age and low-grade population, of which a considerable portion are Negroes. This is fourth grade because of poor prospects and undesirable population. These maps are from a project called Mapping Inequality, which is essentially a group of academics who are collecting historical data and documents to note where these covenants were and what effects they had on certain areas of cities and the populations that ended up there. The maps were part of a story that I worked on with 3 other colleagues of mine at the Chicago Tribune last summer, Jamal Brinson, Darcel Rocket, and Kristen Johnson. It was around the time of the George Floyd protests, and we wanted to take a look at disinvestment specifically, which is what the story was about. We started with segregation and how it happened through redlining and pulled census data from now to kind of connect those dots. And one of the connections we wanted to make for people is that redlining determined who was able to buy or rent property, and that determined who was able to build wealth over generations, leading to the startling stat now that you must have heard of, that white families have nearly 10 times the wealth of Black families, and definitely more than any other race community. So the article took a look not just at wealth and property, but things like education, where schools have increasing or decreasing enrollment. We looked at food and transportation, where are food deserts located, life expectancy between, for example, Streeterville and Englewood, as David talked about, hospitals and clinics, where are pharmacies located and why. And I was particularly proud of this story because I think it is really important to do stories that include historical context to current situations. News can often be quick coverage, which I think is really important, but I think it does harm when it is not followed with something that teaches you about why this is the situation. I think historically, not just the Tribune, but news organizations in general have done a relatively poor job of explaining satisfactorily why things are the way they are instead of just relying on the news of the day. And I'm gonna lean into this at the Tribune, not to embarrass my own paper, but one particularly egregious mistake we made that was actually corrected by the Sun-Times was not questioning the police version of the story of the raid on the Black Panthers that killed Fred Hampton. You must have heard that there's a movie out, which is why this was in my head. The caption to these photos is, the Chicago Tribune published photographs of what the Cook County State's attorney said were holes from bullets fired by Black Panthers during a police raid. In fact, the Sun-Times corrected the Tribune. These circled dots are nails, and you can see the circles on this photo. In 2019, Will Lee, who is a great storyteller and reporter at the Tribune, covered the 50-year anniversary of the police raid and addressed how badly the Tribune got the story wrong because we didn't question the police. And we probably made some assumptions about the Black Panthers. And incidentally, Fred Hampton was from Maywood, which is the area that was redlined as we saw earlier on the map. So last summer, a lot of news organizations went through a reckoning in their response to the murder of George Floyd, the protests, and the general aftermath. There was kind of an acute awareness that large news organizations are very white, and that comes with its own biases that play out when you're covering something perhaps like police brutality. There has been a questioning of the concept of journalistic objectivity and whether or not it ever really existed. There was a bit of outrage when the Philadelphia Inquirer's, I think it was the executive editor, wrote an article titled "Buildings Matter Too." When I think about systemic racism, I'm very, very aware that I work in an industry that perpetuates it left and right, on others, on my own people. And though we do say that we are reconsidering these ideas, I am wary of how that goes and where it ends and who it hurts. I know I'm running out of time. I'm going to try to keep going. Okay, so there are two concepts that I've been thinking about a lot because I know this panel is supposed to have solutions, which is tough because there aren't easy solutions here. But in his set of essays called Known and Strange Things, Teju Cole talks about two things that I think about a lot when I think about my own journalism. One of them is called cold violence, and he describes it when he's talking about the Israeli government's treatment of Palestinians. And he says, putting a people into deep uncertainty about the fundamentals of life over years and decades is a form of cold violence. Through an accumulation of laws rather than by military means, a particular misery is intensified and entrenched. This slow violence, this cold violence, no less than the other kind, ought to be looked at and understood. And this is the kind of journalism I think I want to encourage you to look for. The kind of journalism that focuses not just on gunshots, carjackings, violence, but takes a look at laws and policy and this kind of cold, slow violence that happens. The second thing he talks about is thinking constellationally, which is essentially, he's criticizing the general concept of like American can-doism when it comes to complex issues abroad, which I think can be applied here. He talks about the need to kind of first connect the dots and create an understanding that you might have about the situation before you look for solutions. And because I feel the need to end on a positive note, I want to go back to property. We have a tendency in American urban planning to favor single-family homes to kind of create these nice leafy suburbs. And in Minneapolis, there had been a push to get rid of single-family home zoning, which essentially categorizes areas of the city where you can only build homes for one family, like a typical suburban home. Advocates wanted the city to open up and allow multiple family homes, so like apartments anywhere in the city. This would essentially decrease racial segregation in a city that historically has been segregated because of redlining. It would allow poorer people into areas of the city where traditionally there haven't been renters. Obviously, a lot of people were against this, but in 2019, this did pass. And I want to end just with this one person's kind of hopeful speech. Elizabeth, is that okay? It's like, I'll just play 2 minutes of it. Is that too much?
We have been told we have a strict timeline of 10 minutes. I'm wondering, do you think we could address it in the questions?
Sure.
And perhaps you could post the link to the chat and we will share it with the group.
Yes, I will.
That would be wonderful.
Thank you. I'm so sorry for going over. I had a lot of content.
I understand there is so much to talk about, and my goodness, you've shared your expertise and insights and statistics beautifully. And so I'm going to invite the rest of the panel to come onto the call with your mute button off and share your video, and we are going to engage in the question and answer period. And in listening to all four of you, what strikes me is just what I would describe as a perfect storm of inequity in all four areas of expertise. And so some of these questions really cry out for response from each of you, but we have 15 minutes left for questions and answers. And so I will begin with a question for Dr. Ansel. And initially I had phrased this in terms of what people can do in their own communities, but I'm going to expand this question. And I think it applies to the four of you as well in many ways. Dr. Ansel, your work on the west side of Chicago has included efforts to make delivery of healthcare more equitable and increase life expectancy at the community level. And you all may know that we have attendees from all over Illinois with us today. And so my question is, what are your suggestions as to how they can go about implementing similar strategies in their own community, but in other disadvantaged communities as well in northern, central, and downstate Illinois? Is it hands-on? Is there a single piece of legislation or package? And maybe to narrow it, given our time, if we could only focus on three things to effectively address systemic racism and inequity in healthcare and beyond, what would you recommend as those three priorities? Dr. Ansel?
Yes, thank you. and thank you, all the other panelists here. So number one, it's important to name racism in our own communities as only as a primary source of poor outcomes. I deal with life and death, it's health, but it's actually on multiple different level. And we've heard from the other panelists, and to discuss the historical basis of it and acknowledge it, what's happened. But it's not the only form of exclusion. You know, because we've normalized white supremacism and other forms of exclusion in our institutions and daily lives, it's hard to see how we can dismantle them. So the first thing that people have to do is, and this is for white people and white men, but everyone, you know, who's in this space, we have to make the personal change so the Mr. Coates's comment is just, we're not crazy. These are facts, and they exist everywhere, and these forms of exclusion, by the way, rural areas and other areas are the same. So the naming of racism and other forms of exclusion is critically important, number one. Two is saying that how these systems of oppression, and words matter, are actually perpetuating themselves today as we speak, and they're intersectional. And that those of us who are in institutions, whether they be government, whether they be private institutions or hospitals and things like that, have work to do both internally and externally to dismantle it. And if I could say, you guys said for 3, but I'm going to do 4, is understand that these are intersectional, that you can't, and because they're intersectional, there's a degree of complexity to solve them. You cannot separate out the low life expectancy Garfield Park with the fact that capital was removed violently from these neighborhoods. And these are, and that is going to require, you know, a rethinking of just the way our whole, we're working in all our communities. So, you know, what Rush did, what Westside United did, is partnering with the community and investing back in neighborhoods. But we have to do it writ large, and it's across the state, jobs, education, etc.
Thank you. Delmar Gillis, I'm going to pose the question to you to give your insights as to 3 things we can do to mitigate systemic racism in your area of expertise. And it seems to me that your area also has crossed with Dr. Ansel's. I believe there's a coal facility in the west side of Chicago. So would you address what you see as the 3 ways to mitigate, and also, if you can, briefly address how climate change and racism may intersect, particularly in the, well, let me rephrase that. Racism intersects in areas like COVID and climate change. Are there parallels?
Thank you. Yes, I'm happy to do that. I want to build on, once again, with what Dr. Ansel was saying. I think we need to be able to take a step back and look at the environment in which we live and the time that we're in. I think from a policy perspective and from a programmatic perspective, I think we are in a time that is very dangerous from the standpoint of creating false equivalencies. And we need to really kind of step back and look at how we're even approaching these kinds of discussions. And what I mean by that is I'm eager to debate policy. I'm eager to sit down and discuss solutions. I got some great questions over the chat. And those are the kinds of conversations we want to have, whether it's about COVID vaccinations, the impact on environmental health impacts COVID. If you have asthma because you live in a high-risk area, your risk of having adverse impacts to getting the COVID infection are going to be significantly higher. But Elizabeth, if I'm being honest with you right now, we have a two-party system, and honestly, I don't always feel like I, as an African-American man, can engage with both parties. I like CPAC is going on today. I would not be physically safe if I went to CPAC, and I would not be able to take my kids there. And I know we had talked about the impact on children, but to think that my kids have to know that there is a significant percentage of a political party that has issues with me as a Black person makes it very difficult for me to engage in fruitful policy discussions on things that I would like to talk with both parties about, because they're important to all of us as Americans. So I'll end where I started, which is what Dr. David Ansel just talked about, is we have to find a shared value system where we can engage each other and have these conversations. And we can't establish a false equivalency. I can't talk policy with certain individuals. I can't work with the Oath Keepers on environmental policy. You know, we have to be able to have some shared values on what good political discourse is, so that we can begin to address the environmental, the health, and other issues that are critical to us. And I'm ready to do that, but until we have those values in place, it is a very difficult conversation.
Thank you. Thank you very much. Sharon Mitchell, I think you addressed this briefly, but would you respond to the charge that the criminal justice reform bill that passed HB 3653 is going to make us less safe, and why do you think law enforcement is so hostile to some of the reforms in that bill? And I guess I put this to you in terms of priorities. What do you think are ways that we can further, besides the abolition of cash bail, further improve our criminal justice system? And if you see any intersection with the previous panels, please feel free to comment on that.
When Illinois legalized medical marijuana, law enforcement told us that the streets would run red with blood. They told us that large amounts of canines would be euthanized because they had no job. When we legalized adult use cannabis, they told us that Mexican drug cartels would take over towns and run them because we were doing this legalization. For decades, law enforcement has predicted doom and gloom about every single reform, small or big, and that has not bore out. So I think we have to think about the source before we address these questions. When talking specifically about their history and their prediction history, when talking about cash bond, I think we have to think about what the status quo is, right? The status quo allows money to be the main factor far too often in whether somebody is going to jail or not going to jail. So many times when people think about the cash bond strategy, they think about, we're talking about full release, not thinking about it. But what I would posit is that the current system, which allows for bond hearings that last for 1 minute, 45 seconds, 2 minutes, and has a statute that contradicts itself in multiple positions, where the Illinois Appellate Court has said, I don't know what to do. I would argue that that is something that needs to be changed in the status quo and currently produces decisions that are unsafe. So I think we can look to New Jersey and see that we can reduce pretrial incarceration, we can sharpen the laws, and we can make better decisions about the specific amount of people, specific people who may need to be held, right? Remember the US Supreme Court says, and this was Justice Rehnquist, a champion, a conservative legal titan, that talked about how pretrial freedom should be the norm and detention should be the exception to the rule. And we too often through the media have been, it's been kind of insinuated that our crime problems exist because there are people who are being released and are committing offenses. But when we actually look at the studies, Loyola University just released a study, we found that that's not true. There are certainly stories of that happening. I will not deny that. But remember, that is the status quo. Many times those are people bonding out, right, that are committing these offenses. So there was one more thing I wanted to talk about. I forgot what it was,
Well,
but go ahead.
well, that's all right. And you can certainly put it in the chat or contribute it. We have about 2 or 3 minutes left. And I want
one more thing. Just, I'm so sorry. Can I say one more thing? Law enforcement has said they have not been at the table. That is a lie. That's it.
Thank you. And I want to bring Nusheen Hussein in and just have her comment. And I know Dr. Ansel wanted to respond to something or add to something Sharon stated. But Nusheen, I just want to give you an opportunity to answer questions that have been raised, which is you've shown us that through your work that the pandemic has taken a deadly toll on people of color, especially in the Black community. And so there are existing disparities you've shown us in family wealth, education, business investment, and that those have intensified since you published your article, Disinvestment Rooted in Policy, just months ago. Do you see a starting place to unravel the multiple historical inequities?
So I will just qualify what I say by the fact that I'm a journalist and not a policymaker. And so it is not, in a habit of mine to think up of policies, although the stuff that y'all have talked about have been incredible. My job is to learn about it and convey it to you. And so that's what I will try to do. In our story, one of our sources said, and this is a quote, "Most white people have no idea that the gap is that large and they think it's growing smaller when in fact it's growing larger." And this was specifically about, I think it was like home ownership. I think the place to start is to understand that we are not inherently on a trajectory of getting better. I think there's this idea like the arc of history bends towards justice. And I do believe in that. And I'm a person of faith and I want to believe in that. But it doesn't happen inherently. It has to happen with a lot of work. And so perhaps the fact that your participants are here is a really good starting point. I think the thing that I can talk about is media, and I do see some changes happening there, but I think they're very slow. One thing that you can do as participants here is to think about what kind of media you're consuming. And I'm going to throw a link in the chat here. This is the American Society of News Editors Diversity Survey that they do, I think every couple of years, but for the people that decide to participate, for the organizations that choose to participate, they will track how diverse the newsrooms are. And I'm not saying that diversity is going to solve everything. I don't think that that's necessarily the case, but I do think that a Black person is going to cover police brutality in an inherently different way than a white person is going to do that, right? Because of the experiences that they've had. So I think one thing, if you take away one thing today, from my part at least, it is to critically think about what you're consuming in terms of media and why. And what could you consume that would be different? There are smaller news organizations, there are independent news organizations, there's local media. Think about what you're supporting and why you're consuming things that way. I think that's like, it's impossible to take like one thing away and like, now I'm going to solve racism. But for me, that is like where I would want everybody here to start.
It's a start. Thank you so much. And Dr. David Ansel, you had something to add. And after that,
I just want to say, as Mr. Mitchell found himself defending and when we have to understand that this system, that we're all swimming in a river of white supremacism and other forms of exclusion that are killing literally a matter of life and death for communities. And if we learn anything from, the murder of George Floyd, that this is going on daily in all of our communities, and the amount of work that white institutions like my own and others have to do is really quite monumental. The intersectionality of what everything said, and the importance of white groups like the League of Women Voters and my own self and leadership here is to say, what more can we do right now? I want to leave you just with an example of how heinous this is. So it turns out, and first of all, June has been just terrific from Machine, but it's just been bought out by a hedge fund. So, how much longer will we have this kind of reporting? But I'm going to give you another example in healthcare. CVS bought Aetna. It's an insurance company. Well, that's wonderful. Let's all clap. What does it have to do with white supremacism? Well, it turns out people on the west side of Chicago, we discovered, were having trouble, homeless people experiencing homelessness, getting their prescriptions filled because CVS said you can't get your prescriptions filled at Walgreens. And then they insisted that they had enough places in the west side. Well, we did a secret shopper call with a young woman, called all the places. Turns out most of the places didn't take the prescriptions. But look at the map of the west side of Chicago, the Black West Side. Not one CVS on the Black West Side of Chicago. Corporate policy today perpetuates the historic injustices that have led us, that we're not history, it's now. And what we shouldn't be doing is 1 second defending equity policies. We need to sort of come together, and the League of Women Voters can play a great role in here. We just have to go deeper. It's more personal, and
sorry, you see,
ourselves. I'm sorry to be.
Yeah,
You're
thank you
breaking up.
so much to all of our panelists. We truly appreciate Dr. Ansel, Mr. Gillis, Ms. Hussein, Mr. Mitchell for joining us today. Clearly, this discussion could have gone on for the next, and it needs to go on. But not in this format. We will try to answer the questions that were submitted. We're going to be posting links to the recordings and supplemental resources on the League website. Go to LWVIL.org, scroll down to Issues Briefing, and click on Resources. Please join us at 10:30 for our next session, Welcoming City, Sanctuary City. Thank you very much.
Thank you all. We appreciate it.